You're welcome back. This is NewsFile, it's your most authoritative news analysis platform. And here on NewsFile, we put Ghana first. Welcome my guests for the very first and brief segment of the show today. Dr. Anthony Nsiah-Sarrey is Presidential Advisor on Health. Dr. John Amoesi is Lecturer, Global Health Department, School of Public Health, KNUST, and leader Global Health and Infectious Diseases Research Group at the Kumasi Center for Collaborative Research into Tropical Medicine. Richard Edusapoku is a doctor of pharmacy, CEO and superintendent pharmacist, Garrison Pharmacy. Gentlemen, good morning, and thank you very much for joining us on NewsFile.
Thank you.
Good morning.
Great.
Good morning.
Dr. Nsiah-Sarrey, so at long last, this is where we are. It was anticipated that we were not likely to get the vaccines this early. Some had predicted that the earliest that we may have gotten it would be sometime in June or somewhere like that. How did you manage this to make such history within the continent to be the first to receive 600,000 doses?
Yeah, thank you very much, Samson, and good morning to all your cherished viewers and listeners. Yes, if you remember, at the 22nd update by His Excellency the President, he laid out that we are going to likely get our first batch of vaccines latest by March. But we're working around the clock. We are one of the countries, then about 98 countries who have joined the COVAX system. COVAX facility is to provide vaccines to about 98 countries at no cost to the country, and we are making sure that we get about 20% for the population of the country. So we are expecting about 12.4 doses of vaccine from COVAX. And God being so good, I think the UNICEF, WHO, and the Gavi look at our track record in immunization in Ghana. We are one of the highest uptake of childhood immunizations in the whole world. If you look at Penta-3 as a proxy, we are immunizing about 95% of children. The children in this country are taking about 13 different vaccines, and Ghana has decentralized our immunization system, and we are actively immunizing people. We have the logistics, we have a robust system in place, and this is the reason why I'm very sure, and I heard the UNICEF chief executive saying that's one of the reasons why they chose Ghana to be the first to get the COVAX facility. So we are very grateful to them, and we're also grateful to God that it has happened. So we've been working around the clock to make sure that we start receiving our vaccines. We are getting about 20% of the vaccines that we need for the population from COVAX facility. The Ghana government is also buying its own vaccines, and we are buying vaccines, as the president said the last time, from every source where the vaccine receives emergency use authorization. So far, Food and Drugs Authority in the country has given 2 of the manufacturers, i.e. AstraZeneca and Sputnik V from Russia, emergency use authorization. And we are working assiduously towards acquiring the vaccines from all these sources. We are working also on the other sources from China, Sinopharm and Sinovac. We are working on Johnson & Johnson. We are working on Pfizer, Moderna, and any other vaccine, Covaxin from India, and then other vaccines which are in the country and also in the world. You know that everybody is going to the same manufacturers, the whole world globally, for the vaccines. So we'll be getting the vaccines periodically. So this is the first batch of 600,000 vaccines which have come into the country, and we are going to deploy it on Tuesday next week.
Do you mind sharing any details about the further attempts or processes, as you say, in getting vaccines from all other sources? What are the specifics that we have done so far, and what are the timelines we are looking at? Because 600,000 certainly is just a good start, but certainly not something to be too excited about, right?
Yes, something we, as I said, we are getting for about 6.2 million people in Ghana. So if you are using the vaccines with which we are supposed to give 2 doses, we are expecting 12.4 million from COVAX. That's one source. And COVAX initially said they've allocated about 2.4 million of these vaccines to us. So the 600,000 is the first batch which is coming. They are sharing to all the other countries. The second place that we are trying to get vaccines from is using bilateral collaborations. We, like any other African country, is on the African Medicine Supply Platform. The African Medicine Supply Platform enables us to use their platform to access vaccines from any source. So we are also have placed orders, and we are almost concluded the orders. We have to place the order. We have to sign agreement, which we have done. We have to also send your letters of credit, which we are in the process of doing, to get vaccines also from that source. So the balance between what we need, because our budget is, our target is to immunize about 20 million of the population of this Ghana. So it means if you are using 2 doses, we need over 40 million doses, plus about 5% wastage, so about 42 million doses. So the rest of the 42 million, if you take out the 12.4 million doses from COVAX, Ghana government is sourcing it. And we've done a lot of work. They've already gone to, for example, Sputnik. We are talking to Sputnik through the embassy, Russian embassy here in Ghana, also through the sole representative here in Ghana who came to help them to get this emergency use authorization. So these are some of the things that we are doing. We are also talking to other people. For example, the M-Plaza using the platform of the private sector is also trying to bring in some vaccines. And what they want to do is that any vaccine that they bring, they will also add the same amount of vaccine to it for the general population. I know that they want to bring in immediately about 2 million vials of vaccines, and we are working together with them to get where they are bringing it, and then we will bring it into the country.
Yes,
so we are getting from all angles, from the private sector, we'll be financing some of the vaccine which is coming into the country, and the main bulk is from the Ghana government budget, which we have already allocated budget for it.
Right. So Doc, you mentioned
unveiling and then telling Ghanaians how, when, and which vaccine is coming periodically. I'm very sure that within the next week of 2, we will get another batch of vaccines coming into the country.
Okay. You mentioned private sector participation. Is the health sector, private sector, allowed, or is there room for them also to procure and to, as it were, administer, just like we had for the test? Private, clinics or hospitals were also running the test as well.
No, not for the vaccines. The vaccines are special medication that we are bringing into the country. As you are aware, we have to follow the vaccines. If there's any adverse drug reaction, and it's being controlled very well by the Ghana government through the Ministry of Health. So the health sector is participating in the financing of the vaccines into the country. But we are not going to use the health sector as profit or selling the vaccines to people and then taking profit. But for example, if any of the private hospitals like Nyaho and the rest, we'll be using them as also vaccinating centers, because we want the vaccines to go to people who need it. We don't want money to be a barrier. So there should be no financial barrier to anybody. And I think if you look at the whole world, what is happening is that the vaccines are free to the anybody who comes to be vaccinated. So that's exactly what we are going to use. And we are not going to allow anybody to sell the vaccines in any place. So for the meantime, the emergency use authorization is given to Ghana government to bring in the vaccines, and our EPI, the Ghana Health Service, will be the people who will be managing the deployment of these vaccines.
So directly you are saying, your answer is straight, that a private health facility is not allowed, even if they have the capacity to procure the vaccines for the purposes of also administering to the public at a fee. It's not allowed.
No, that's what I'm saying exactly. But if the private sector or the private health facility wants to finance it, they are free to do that.
Can you
explain
explain
the
that?
Ministry of Health.
If they want to finance procurement of the vaccine through the Ministry of Health, they are allowed to do that?
Yes. But they cannot bring it in and sell for profit. No.
Okay.
We are giving everything free of charge, but they can participate as a vaccinating site.
Okay, so they can participate, as you said, as a vaccinating site, and also by helping with the finance, which will be sort of a donation.
Exactly that.
Okay. So
in fact, let me add quickly that we are also using a lot of the private facilities as vaccination sites.
Right.
Unveil it, and everybody will know where you can get a vaccine when you go there, when it's your time to go for vaccination.
Okay, talking about vaccination sites, we hear elsewhere they are using church rooms and all of that. Are we going to deploy as much school facilities and so on?
We are using exactly what we have been doing when we have vaccination, mass vaccination. This is going to be mass vaccination, but it's in phases. So some of them will be static, some of them will be mobile, some of them will be moving even to people's houses, those who cannot come out, and we know very sure that they need vaccinations. So we are going to do a combination of them, like we do for yellow fever and other mass vaccinations. So they'll be static. We can use churches, because if you realize when we are doing yellow fever vaccination, sometimes the camp is in the church or at the Cheese Palace, and most of the vaccination sites from now, of this 600,000, will be in the health facilities and other, say, pharmacy shops. If there's a space in front of, for example, NS Chemist, or if there's a space in front at the judiciary, if you are going to do it for the judiciary, you can have a camp there and do it for them.
All right.
Parliament, if you want to do in Parliament, we use the Parliament health facilities.
Thank you for that. Thank you for that. You spoke about.
So we'll be doing a combination of things that we normally used to do. We know how to do this,
right.
And we've been doing it for a number of years.
We have been informed sufficiently about what we already have, an already existing system and protocol for vaccination, and Ghana has been applauded for doing very well in vaccination. So I suppose that there's a lot of confidence in that area. But you said that the next batch, for example, might be coming in the next week or two. The one that is coming in the next week or two is not what government is buying. It's also this one from, is it Gavi or whatever? So it's coming free of charge, right? We are not paying anything for it.
No, the ones which will come in the next a week or two, maybe a combination of what government is buying directly and what we have also from COVAX.
Right.
So it will be coming in combinations. Government is buying majority of the vaccines. We are at a very advanced stage to get the ones the government is buying, as well as the one coming from COVAX facility.
Right. What's our budget for this? And we are not paying a dime for what is coming from COVAX facility, right?
What is coming from COVAX facility, we don't pay for the vaccines, but we are paying for the deployment and also for bringing this into the country.
Right. What's our budget?
The EPI, Ghana Health Service, Ministry of Health, have come out with budget. There's one. We are budgeting, you know that I said that we need about 42 million doses. So if you subtract the 12.4, it means that the real cost of the vaccine. So the rest of about 38 point something million will be directly the one that the Ghana government is buying. 2, vaccines from different manufacturers are at different costs. Ghana government wants to buy directly as much as possible from the source so that we are not going to use a lot of middlemen who will put price here and there and all sorts of things. So we'll get the vaccines at the right cost, especially using the African Medicine Supply Platform. They know the cost, and then most of the time they even try to beat the cost from the manufacturers even down a bit. I know that vaccines from AstraZeneca, the cost is about $3, $4, $5 US dollars per dose. If you use the Sputnik V, it's about $10 per dose from the manufacturer. If it's Pfizer that you are using, it's about $19 or between $15 to $19 per dose. The most expensive one that I've seen so far is the Moderna, which is up to about $33. So depending upon the vaccine that you get, the price will be different. But Ghana government has put a budget, a composite budget, the first budget and the second budget, if we have exhausted the budget, but we are trying to ring fence some money to cater for the ones that you buy and also cater for the deployment of the vaccines in the country.
Okay.
I think it is a public document what Ghana Health Service through the Ministry of Health have presented, that it's the cost per deployment per person. All right. So I think about $3 or so per person. Okay. So if it is two doses, it means every shot will be about $1.5 to $2 per person. Right. So we have all this budget in place. Okay. Thank you, Doc. The Minister of Finance.
Thank you, Doc. I'll return to you. Money. I'll return to you so you give us an idea. We know that the first group of persons to receive their jabs, the president will start also to do the very important symbolic process that will also give assurance to people who have, some concerns about it and who are consuming some of the myth around it. But when I return, I'd like you to tell us how exactly you intend to identify that other segment of people with pre-existing conditions across the country. How are you going to do that in the villages where people don't know their ages and so on and so forth? But Dr. John Amoesi, listening to Dr. Nsiah-Sarri, reassuring.
No, thanks, Samson, and good morning to all those listening all over the world. I think we must be, very clear about this. Ghana needs to be congratulated for this milestone of being able to bring in these vaccines on COVAX first. It is no simple feat. And I think Ghanaians all over must celebrate this. I can tell you arch friends, if I put it that way, in Nigeria, are totally jealous of Ghana for being the first to get these vaccines in COVAX. So that's really great. So a lot of the things that Dr. Nsiah-Sarri said are perfectly in order and on point and well appreciated. But it's also important that Ghanaians appreciate the complexity of this process and are able to put forward the right kinds of arguments that would help us to make the right choices and also to control any kinds of challenges that may come our way with the deployment of these vaccines. There's so much that goes into the choices that inform which vaccine we're going for. There's trade-offs here and there, and we've seen the way different countries all over the world have done things. In the U.S., for example, they've registered only 2 so far. They're currently considering the Johnson & Johnson. It's common knowledge that this Sputnik is never going to make it into the U.S., obviously. But why is the U.S. deciding to register, for now, only the Pfizer and then the Moderna vaccines? Why is it that the UK MRHA registered only the AstraZeneca first? And even Dr. Fauci in the US was criticizing the UK and saying that they went too fast in registering AstraZeneca. Eventually, the European Medicines Association, the EMA, registered the AstraZeneca, but unfortunately, less than 30% of the AstraZeneca supply to Europe has been taken so far, and Europeans are refusing to take the AstraZeneca. Why is this the case? So all I'm saying is that we need to appreciate who we are as a country and what informs our decision. What has been, again, let me put this forward. Why did the Russians go ahead and do mass vaccination in their country, literally, when they had not yet done phase 3 trials? What informed that? Was it foolhardiness or was it science? Now, I'm giving all these almost contrasting and conflicting examples among developed nations, and including an advanced nation in Africa, South Africa, which did order some AstraZeneca, but now about 1.5 million doses, but is not going to use them because of their concerns with resistance or inefficacy against their variant, and also their concerns that they have expressed about other adenovirus-based vaccines. Just to show you that there is complexity. What does that mean for our country, Ghana? The key thing about vaccines is the safety and the efficacy. Safety and efficacy. The most important thing is the safety. So far, no vaccine developed by anybody, be it in the US, in Europe, in India, in China, or wherever, has shown any safety issues. And I think this is a very important point we need to drum home. No vaccine whatsoever has had any safety issues so far with regard to COVID-19. Efficacy, we see clearly, has varied widely depending on where you are. And this is where the rubber hits the road. The efficacy, the price point, the logistics that go into bringing it in, storing it, and distributing it. Why would we have certain vehicles which are authorized or allowed to be used in the US, maybe in Europe, but we have vehicles that are authorized to be used in Ghana or in India or in South Africa, which will not make it to Europe or make South Africa? Does it mean that we are shortchanging ourselves by having standards which might be considered lower, if I can put it that way, than what they would have in the US or the UK or elsewhere? My simple and straightforward answer is no. The argument is safety and efficacy. We are in a dire situation. We are at the lowest rank of the pecking order when it comes to access to vaccines. And thank God today we have our own African champion, Dr. Tedros, at the head of the WHO. Thank God that we also have Dr. Mwela at the head of the WTO right now, and they're really pushing for Africa. It doesn't mean things are going to be easy. So we've got to pick our shots when we get them.
Yeah, what do you
have access to?
Yeah.
What do you want to point, Samson? I just want to press on the point. We have access to the AstraZeneca. We're going to have access to the Sputnik. The efforts being made to bring in the Pfizer, BioNTech, and so on. Johnson & Johnson, wonderful. One shot, $10. Definitely a better deal by far than your Sputnik, which is going to be 2 doses, each 9.75. So it's almost double the cost of the Johnson & Johnson when that eventually goes through. What that tells you is that we need to look at these critically. Safety, no issues for any vaccine whatsoever. So it means that the decision-making points are the efficacy and the cost. The efficacy and the cost.
Well,
do we have the same ability to choose out of luxury like the US would have and say, we want only Pfizer and Moderna now because it's going to give us 95%? Do we have the luxury to say, oh, AstraZeneca is 70%? No, we want 95%, so we don't want AstraZeneca. So these are questions we need to ask. So if you ask me right now, so far, the decisions we've taken in Ghana are scientifically sound and economically sound. What we need to do is to continue and make those deals, especially with the Pfizer, BioNTech, and with the Moderna, because I can tell you that the news coming out is suggesting that very soon the Pfizer vaccine may be able to be stored at temperatures much higher than what it is now.
Right.
And the price point that the AU is getting the Pfizer, BioNTech, it's very close now to the AstraZeneca. So there's a lot going on. So far, we're on the right track, and we must press even harder. The challenge for me is going to be how we deploy these and how people are going to accept them. The evidence on the ground suggests that it's not looking pretty. and we've got a lot of work to do to make people aware. I've got people who are well educated with PhDs who are asking a lot of questions about this vaccine. They're not sure about it.
Right. So
we need to make them understand.
So I will shortly have Dr. Richmond Edusapoku help us with busting some of the myths that he's heard around this, and also the critical issue of the storage, the delicate nature of the storage, and the need to ensure that we get that right. Otherwise, you may be giving jabs that are useless anyway. Now, I wanted to know from you what you thought about the emphatic no that I got from Dr. Nsiah-Sarrey about private hospitals wanting to bring in, say, AstraZeneca or Sputnik for their customers, which would appear would also have relieved sort of the burden of the state in administering to the numbers that it's expected to do. What do you make of that? That you cannot use your private resources as a hospital to bring in what has already been approved by the FDA for the purposes of your consumers. Dr. Amwesi.
No, thanks for that, Samson. I can tell you right up that I totally agree with this statement. I was actually already shaking my head as soon as he started asking that question. And I agreed with that question because when Dr. Nsiah-Sarrey started speaking, I was concerned that the suggestion was that the private sector will be allowed to bring in some of these vaccines. You see, these vaccines need to be tightly controlled. And you need to be very sure that whatever comes in is authorized. There's a bunch of people out there who are already preparing the fakes. The fakes are already there. So if you're able to tell people in Ghana that only A, B, C, and maybe D vaccines are authorized, anything else is not authorized, you're much safer. Even in the so-called advanced countries, they are not getting into this private sector supply chain kind of thing for the vaccines. It will be a completely wrong move, a faux pas, for us to allow the private sector at this stage to bring in vaccines and distribute. And quite honest, I can say this bluntly, and I say this totally in the interest of the country and our safety and our integrity. The government must continue to tightly control this and ensure that we can track and trace every single vaccine that comes to this country. We must also put in place mechanisms to detect any fakes that might come in, because this is not child's play, it's life and death.
Right. Okay. What do you have to say about, as I mentioned to you earlier, what do you think about our storage capacity? Do we have the assurance that everything will be all right? And what are some of the myths that you have heard that you think that we should concentrate some efforts in busting? And I'm asking you, Edusapoku.
The myths are real, even in advanced countries where literacy rates are high. People have all sort of conspiracy theories. Okay, I remember 2 days ago when I was shaving my hair, and one of the guys in the barber shop said, "Doctor, will you take the vaccine when it comes?" I said, "Sure, I will take it anytime. Even yesterday, I will take it." And he said, "Really?" I said, "Yes." And I took time to explain to the person why it's very necessary to take this vaccine. I think one of the myths has been that this vaccine has been developed too quickly. And what we are talking about is not a matter of people who have not been to school. We're talking about people who are very educated and still have issues. And there are clear reasons why these vaccines have been done so quickly. First of all, China released the genome of the SARS-CoV-2. Straight away, there's a lot of technology now. We can get the genome done, in weeks. Previously, it wouldn't be so. The moment the vaccine developers got the genome, they started working on it right away. And there are a lot of technology now. What Moderna and Pfizer is using, the mRNA technology, is been existing for over 20 years. But scientists realized that no, there's an opportunity for us to test this technology, and then they moved on. This vaccine, you realize countries like UK gave almost $1 billion advance payment to vaccine developers. So money was there, resources were there to be able to make sure that these vaccines are on point in terms of research. And even before authorization came, because of their studies at phase 1, 2, and 3, quickly, they started producing some of these vaccines, even while waiting for authorization, because they realized that if authorization is given and you are now going to start the production, it may slow. People are dying day in, day out. So these factors, all these factors make sure that the vaccine landed as quickly as possible. For instance, we do something that we call phase 1, 2, and 3 in terms of clinical trials. Now, what the vaccine developers did was that they were running these phases simultaneously. All these things help to cut the time. So we need to explain to Ghanaians that in the scientific world, all the steps that were taken to make sure this vaccine is safe, they were done. But they were done at record time. And therefore, nobody should be afraid that there's a problem with shortchanging the system. No. So that's one common myth. Other myths that I've heard, for instance, on social media, and in fact, even with the speed, now there are a lot of volunteers to run these trials quickly. And something, let me even add now. You see, for instance, in Africa, under 14 years, we've got over 40% of our population in there. Now, these vaccines are under 16 years, they're not trialing it. So what will be our role in there when Africa, Ghana has such a young population? We need to have a look at that.
How much of an impact do you think the president taking it and the whole of the country getting to see that he's getting his jab, and perhaps other, VVIPs, if you like, also taking it, and the whole country getting to know, how much of an impact will that do to take away or remove the myth?
So say personally, I would prefer that heads of COVID treatment centers take the first job. The way we treat politicians and our faith in them. I'm not saying I don't trust the president, but people will criticize. Politicians are taking the first jobs. They are the first on the run. So I would prefer that the frontline workers, the people who are the treatment centers, the COVID treatment centers, they take the first jobs. I think you clearly see this across the globe. And I don't think when you see doctors at Kolebu, 37, Konfanoche, University of Ghana Medical Centers taking these jobs, these are the people who are looking after the COVID patients. It endures to the benefit of citizens. Politicians later on can follow. That's my personal view.
All right. Yes, so Dr. Nsiah-Asare, I was asking earlier, how are we going to go about identifying the aged and the people with the pre-existing conditions who must join the category of those to receive it first, together with frontline persons and the rest? How are you going to do that, particularly in villages? Hello, Dr. Nsiah-Asare. Please unmute. Please unmute.
Okay, sorry. Yeah, thank you very much, Samson. As I told you earlier, our immunization system in the country is completely decentralized. So we are going to use our community health nurses in the villages. We are going to use our volunteers in the villages, the assemblymen and the rest to tell us who is old and sick in the house who needs to be immunized or vaccinated. That's one. Two, there are also this group of people with underlying illness attend clinics and hospitals in the country.
Right.
We are using the data of people attending, for example, hypertensive clinic, diabetic clinic across the country, also as another source of data that we are going to use to immunize them. That is very easy. We just call all of them and tell them to come to where they do their clinic and they'll get their jabs. Those at home will also be identified, as I said, by the assemblymen, the unit committee members, the volunteers who are helping our community health nurses at the CHIP zones. They will also bring them up. So this is exactly what we are going to use. And individuals who know that your grandmother, your mother, who is above 60 is at home, and then you will also come for the jab. Right. Going forward, we are going to have an app where people can also book appointment so that you book an appointment, and then you'll be sent the SMS message that it's time for you to come for your immunization, especially the second doses after 8 weeks, so that you are prompted and then you come for the immunization. So we are going to use all these multiple systems to identify the people. And as you rightly said, we've segmented the population into groups, and we have also done what you call geographical segmentation using the data that we have, that we are starting from the hot areas. We know when you see the Ghana Health Service dashboard, you will realize the places which we call the hotspots. The greater Accra metropolis of the surrounding districts like Awutu, Senya, West and East. And also if you go to the greater Kumasi metropolis, these are the hot areas that we are having in this country. So they will start having their vaccinations, and then we follow it up with the next hotspot, and until we finish having our target, which is the 20 million population of the country.
Yeah, Dr. Nsiah-Sarrey, just got a couple of minutes, but very quickly, you mentioned an app. We know that there was supposed to be this contact tracing app, which people have said, didn't amount to anything really. We didn't see anything about it. It was just, sprung on us and nothing really was done. This app, is it being developed or is already in? And how is it going to work?
Yeah, we've seen about 2 or 3 people have come to show us simple apps that we can use to let people register and people come for the immunization. So, and then we will not even, you remember that during the registration, getting to the end of the registration, Electoral Commission also developed a very simple app where people were using it to book appointments. So we are looking at all these things. So starting, we will use the data that we have. We will do the announcements. We will do the people in the villages will also hear from their communication centers, and we will use the mass media. We use the information service division. And in addition, those who can use apps can go on the apps and then book appointment and then go and have your immunization.
Okay. In 30 seconds, what will be your final word? What will be your final word in 30 seconds as we get ready to begin the rollout?
My final word is that we've been giving 13 vaccines, different vaccines to children in this country. We take the children for these vaccinations and nothing happens to them. That's the reason why since 2003, we have not had a single death from measles. Now is the turn of the adults. So please, let's show our children and our grandchildren in this country that when they are young, we take them for immunization. Now it's our turn for only maximum 2 jabs. Let's go for it.
All right.
Do not do anything to you. You save yourself, you save your neighbor, and then you save the country. Thank you.
Thank you very much. Dr. Nsiah-Sarrey is the Presidential Advisor on Health. Now, Dr. John Amoesi, finally to you also, I don't know how you feel about this, but I have a certain feeling that we are now going to use our assembly members and so on to go and look for who must receive a jab in the line of the first receivers. I would have thought that perhaps by now we would have had that everything set up already. You are not concerned?
No, I think you asked a great question. I certainly am concerned, maybe at a more macro level than you mentioned. And it just goes to what I've been speaking to for a long time, which is our ability to collect high quality data. Let me be very clear and emphatic in stating that here in Ghana, we have performed much better than many other African countries. You just compare to Togo, to Burkina Faso, to La Côte d'Ivoire even, and several others across the West Coast. It is phenomenal what we've been able to do, but it is just not enough to provide us with enough information to make this pinpoint, really precise surgical administration or deployment of the vaccines, which will save time and will save costs ultimately. We only now, thanks to support again from the government, trying to roll out a seroprevalence study. We do not even know exactly what our seroprevalence levels are. in a country even like Mali, which is less advanced than us, they have the data on this. It's very interesting in the urban areas, but they've been tracking the seroprevalence ever since, from the middle of 2020 through to the end of December 2020, showing a change in seroprevalence in urban areas of about 20-something%, and now almost 60%, close to 60% seroprevalence in Bamako, and in rural areas now almost about 45%. Now, this is the kind of information that helps you to know how many doses of vaccines you need and how you can deploy them. If I had my own way, I'd have even loved for people to do a seroprevalence, a serology test before we taking the vaccine, but that'll be wishful thinking. So all I'm saying is that we need to ramp up our testing regime, because even without that, how can you even tell how effective the vaccine is in reducing transmission? Exciting news coming out of the UK, so just in a few more minutes. I must talk about this. A few more minutes. Just showing how the vaccine not only reduces your risk of getting ill, but also reduces the risk of transmitting the virus itself. That's phenomenal. How can you know this if you're not doing really precise testing and being able to measure the changes in rate of transmission? I'll keep on harping on this and hoping that we can do this in a very systematic way in order to further improve our ability to roll out these vaccines and get the best we can out of them. But definitely those vaccines, we've got to take them and take them fast.
Right. Thank you so very much, Dr. John Amwesi, lecturer, Global Health Department, School of Public Health, KNUST, and leader Global Health and Infectious Diseases Research Group at the Kumasi Center for Collaborative Research into Tropical Medicines. Has been so useful, helpful to us as a nation in this time of COVID. Final words from Dr. Richmond Edusapoku. Having heard from both Isiasari and Dr. Amwesi, what do you have to say to conclude?
Yeah, what I have to say quickly is that this afternoon, for instance, the FDA is meeting community pharmacists on a Zoom meeting. We have to document any adverse effects of these vaccines that we're taking. These vaccines, as much as we don't allow them to alarm the citizenry, is not just injecting water. Now, there are some people who may have had COVID before, and they have a bit of antibodies already in the system. If they take this vaccine, their immune system defense will prime up into gear. They may have a few, malaise, fatigue, slight temperature changes. These kinds of education are needed because, Ghanaians, sometimes we even, the folklore, somebody sick, somebody said the genital got missing. So Ghanaians will just be looking up for any effects, untoward effects, and blow it up. FDA has an app called MedSafety app. And therefore, the plan also is that for community pharmacists are widespread all over the country, over 2,000 community pharmacy practitioners. And therefore, our role is that if anybody has any adverse effects, they can walk into a community pharmacy, talk to the pharmacist, we'll input this data straight to FDA database. So I will advise that we do education. I think that the EPI has a communication and advocacy section, and I think that they should not just ally themselves into the Ghana Health Service, to stretch out, meet private people, independent community pharmacists like us, and then we will help with the education. When you talk to Dr. Isiasari about the role of private sector, yes, just like the abuse, but I think that we must both in Ghana. Can you get NHS? It's not just only public health workers or public sector alone. The private play a very crucial part. In the US, for instance, as soon as they were trying to develop the vaccine, I remember the CDC and other state governments and community pharmacists to be able to vaccinate as quickly as possible, even before the vaccines were produced.
All right.
But here in Ghana, I don't know, for whatever reason, it seemed as if only government-owned hospitals and clinics are the one playing the game. I think that if you're educated for 6 years in the government wouldn't take advantage of the taxpayers' money and get me to help in the system, I think that is wrong. Okay. I think that must be expanded.
Thank you. Thank you so very much. Richmond Edusapoku is Doctor of Pharmacy, CEO and Superintendent Pharmacist, Garrison Pharmacy. Thank you all so very much. And Dr. Mwakohene, who was on our show a couple of weeks ago from the USA, says that we should also be careful about one thing. Once we are the first making history to have received it in the continent, we may begin to become confident in a certain way that may get us relax our protocols, and people may become complacent, saying vaccine is here, so why do I go through the various protocols any longer? US suffered a bit of that, and within a short period they had such a spike and so many deaths. So let us be careful. The vaccine is here, but until we get our jabs, where we are supposed to even get a second jab, until we get all of that, please do not relax on washing your hands under running water as frequently as possible, using your sanitizer, wear your mask, and at all times in public, you must have your face mask on. We take a break and return shortly with Professor H. Kwesi Prempeh, Executive Director of the Ghana Center for Democratic Development, CDD, Ghana. We will have Joyce Bawa Mokhtari, who is lawyer and special aide to John Dramani Mahama. Also, Andrew Ejapa Mesa, lawyer and MP for 2nd D. They will join us as we get into the Supreme Court to try and avoid contempt. Or shall we get into it for seeking to talk about what they are troubled about? And then also the very vexed matter of LGBTQI, and there's supposed to be a plus because it's unending. We'll be right back.